Connecticut's medical community is bracing for enterovirus D68. Now, the respiratory illness that sent hundreds of the kids at this point to the hospital in other parts of the country. Now, Fox Connecticut's John Charlton joins us more. He talks about the medical community's concerns. John.
Well, Jen, it could be just a matter of time for enterovirus D68 to get to Connecticut because travel makes transmission easier. The State Department of Public Health says it's provided a CDC fact sheet about the virus to the Department of Education as well as school nurses. Public Health has also advised medical professionals to look out for the virus, consider testing for it in extremely sick patients, and certainly report positive tests or unexplained respiratory illnesses. A Midwest public health crisis is creeping east and west across America.
Wouldn't be at all surprised to see it in Connecticut. To my knowledge, it hasn't been seen here yet.
Hundreds of coughing children winding up in the ICU is nothing to sneeze at. But that happens to be a common way enterovirus D68 is spreading.
Just an unusual version of this very, very common summertime and fall virus.
Unusual because the cases are exploding, even though D68 has been around since at least the 60s when scientists first discovered it. The severity of the symptoms is also alarming. So why all of a sudden now is unknown. But there is a theory why it's just getting kids sick.
Well, kids haven't been exposed before. Many of the adults probably have come across this virus and have developed immunity over time, and the kids are the fertile soil that haven't met the virus before and haven't developed immunity.
Despite a lot of children winding up in the hospital with severe respiratory issues, the virus has not claimed any lives. There's no vaccine or magic cure for D68, so doctors are helping kids get over the hump by treating the symptoms. This isn't a point where we have to panic or parents have to panic keeping your kids away from school.
Absolutely not. Again, most of the kids who get any of these enteroviruses get mild illness. It is spreading and creating a pretty significant burden on hospitals and healthcare systems, so that's really the concerning part.
And doctors say children with asthma are most at risk for catching the virus and getting very